Busy people getting fit in Fulshear, Texas. Our aim is to help you look better, feel better, and perform better as quickly as possible. I'm your host, Bryan White with Blue Eagle Fitness and Nutrition. Welcome. Hey, what's up, everybody? I am here today. Beautiful day outside. The weather's like 78 degrees, which has been great. I'm here with Miss Lara Hamilton from Christ Clinic. Welcome.
Thank you.
We're very happy to have you.
Thank you. Thanks
and
for
by
having
we,
me.
I just mean me. Me and the audience. I say we a lot, mainly when I'm coaching, because learn this from restaurants. When the server says we, people leave a bigger tip.
Wow.
So there we go. Everybody has learned something today. No matter what, you've learned that. So I'm here with Miss Lara Hamilton, and we are here to learn more about her. And she is, what is your official title?
Executive Director.
Executive Director at Christ Clinic. So let's get to know you a little bit better. First of all, tell us more about like where you were born, where you were raised, your family, all that kind of good stuff.
So I was born in Baytown.
Okay.
And then soon after, my parents moved to Ranger, which is a tiny little town in between Fort Worth and Abilene, in the middle of nowhere.
Okay.
Some people may not even know what Abilene is. West Texas.
Okay.
Kind of.
Gotcha.
Yeah.
Gotcha.
It was like 1,800 people when I lived there. Now it's less.
It's less.
Yeah.
Oh, wow.
My graduating class had 40 people in it.
Okay.
Now they have closer to 11. I just
Ooh.
went back for my 20-year reunion. So.
Okay.
Yeah.
Wow.
Yeah.
Wow. So you lived in Ranger.
Mm-hmm.
And how did you end up in Fulshear?
Well, I went to college in the Dallas area, and then that's where I met my former husband, and he was a firefighter.
Okay.
And he wanted to work for Houston because
Okay.
they're the biggest and the best, and they have a great retirement. So,
Okay.
so
I love it.
he like on a whim was like, I'm gonna apply for Houston, and you know it's a whole process. And so I was like, okay. We didn't really think it was gonna happen, but then they offered him a job, and so we moved, and then been here.
Very cool.
Since.
Very cool. You were telling me earlier you have 4 kids.
I do.
And they keep you very busy.
Yes. Yep.
Awesome.
So 23, 15, 3, and 1.
Okay.
Yep.
That sounds tiring.
Yes. It's really weird to be talking about like adulting and what
Sure.
percentage of your income should your rent be, but also changing diapers. You know?
Yeah, that requires a certain skill set that I would say most people don't have.
I don't think anybody really plans to have it. I think you just, once you're in it, and you wing it.
Yeah. Yeah, but still, I mean, there's a talent in like having a mind focus on one thing and then switch gears. Like, because a 1 and 3-year-old, they're not like, oh, mommy's adulting right now, let me give her a break. Right? They're not doing that.
Yeah, that's a good point.
Yeah.
I do have ADHD, so that might
Which
might be.
In this case might be helpful.
It might be, yeah.
What do you like to do for fun?
Anything outside, pretty much. We're animal lovers, and I love to do anything adventurous and outside. So
Now, when you say you're an animal lover, how many animals are at your house?
at my house
Yes.
are 2 dogs.
Okay.
One's an English Mastiff, and one's a French Bulldog. We did have 11 chickens until 2 days ago when my husband slaughtered 3 of them because we had too many roosters.
Okay.
And we're going to eat them.
Okay.
And then I have a guinea pig also, and well, my son has a guinea pig, but I think that's all the
That's
animals.
it?
Yeah.
Okay. And the chickens are outside in their own little coop?
They are, until my 3-year-old brings them in, and she just opens the door and throws one in the house.
Because,
and then back outside.
Because why not? Why
Yeah.
not? I mean, that's what we do with chickens, is we throw them in the house and let them run around.
Some people do, I guess. I mean, I put them back out, but yeah, she likes to bring them in.
Does she name the chickens?
They all have names.
They all have names.
They do.
Do you know the names of the chickens who are no longer with us?
Yes.
Okay.
Yes. Do you want me to share the names?
Sure, yes. I'm intrigued.
Mr. Poppers.
Of course.
Olaf and Adolf.
Okay.
Yeah.
Okay.
Adolf. We have an Austrian au pair that lives with us.
Okay.
And so, and we're funny people. We like to joke a lot. So one was named Adolf.
Very cool. So you've got a busy family life. You have, I lost count of the total number of animals at your house. Mm-hmm. But on the rare, what may seem like a rare occasion for you to have a night to yourself or a date night or something, what do you like to do?
Well, we like to do all kinds of things. We like a variety of things. So we really like Brenner's in downtown.
Well, well, I don't know anyone who doesn't like Brenner's. Good choice.
And then we also like to go out to Anthony's. Also a great choice.
Okay. Yes.
But then I actually keep a list on my phone for date night ideas. So we do date nights regularly. And one of the ones that we have coming up is my husband used to own a motorcycle, doesn't now, but we're gonna rent one and we're gonna go cruising for a day.
That sounds awesome.
Yeah.
Okay. Was that your idea or his idea?
Mine, actually.
Your idea?
Yeah.
Okay. Mm-hmm. My wife came home one day and was like, hey, I want to go on a date. Love it. Love going on dates. She's like, let's go to a shooting range.
Oh, yeah.
I was like, what? I mean, usually we go shoot guns like when we go visit family. I'm from Northeast Arkansas, out in the middle of nowhere. She's from Oklahoma, out in the middle of nowhere. Mm-hmm. I mean, guns, like there's literally nothing to do except shoot things.
Guns. Yes, same where I grew up.
So that's usually the only time we've shot guns, but we actually went to a gun range, which we had never done before.
Yeah, that's a fun.
Shot inside, Yeah, it was fun.
Yeah.
Cool. Okay, so you are the executive director of Christ Clinic. How did you get involved with that? How did you get started with Christ Clinic?
Well, I'm a nurse. That's my formal education. And I applied for a job in labor and delivery at Christus Health, which was the hospital that used to be in Katy.
That's where my two oldest were born.
Okay.
I know that place well.
Okay. So the director of nursing at that point was on the board for Christ Clinic and saw my application and thought that based on my experience, I would be a really great fit for Christ Clinic. And so she called me and told me they were looking for, at that point, a clinic director.
Okay.
And so I went and interviewed and fell in love with it, took a huge pay cut.
Sure.
Started working on the weekends also so that I could take that job instead. But yeah.
Okay. And what does Christ Clinic do?
So we mostly do primary care. We do some specialty and stuff like that also. But we mostly do primary care for people that are uninsured and low income. So our primary purpose is to provide health care to people that fall through the gaps of all the other systems that exist. So we're like the true safety net. Okay.
What is, when you say low income, what is your definition of low income?
200% of the federal poverty level. So you could Google it and it's on the internet and you could see how many people live in your household and then what your income is and where you fall. But for a family of 4, it's about $52,000.
Is the income the threshold for
so
you or the
that is 200% of federal poverty level.
Okay, 52,000 ish. Yeah, is the 200% for a family of 4. Mm-hmm. Gotcha. Mm-hmm. And so, what you mentioned, primary care. Are these when they're sick or when they're ill, or is this preventative?
All of the above, just like your primary care doctor. So we'll do screenings and well physicals. We'll also do sick visits. So if you have the flu or it's cold sometimes or a UTI or something like that, you could just walk in and be seen. And then we do a ton of chronic disease management for diabetes, hypertension, stuff like that.
Gotcha. How many people are we talking about in this community that you see?
So annually we have around 5,000 patients depending on the year, 5,000 individuals, and we do around 10 to 14,000 visits depending on the year.
Okay. And how many doctors, nurses, staff?
So we rely on volunteers a lot. So we have a lot of volunteer physicians that give time to us. We staff almost 2 full-time equivalents for providers. So we don't have any staffed physicians. Even our medical director is a volunteer. but we staff 2 nurse practitioners.
Let's start over. Okay. You have no staff that are on salary or
physicians.
Physicians.
Yes.
Yes, at the physician level.
Yes.
These are physicians who are volunteering their time, energy, resources.
Yes.
Okay. So today is Tuesday. I read an article on Sunday in the New York Times about how 75% of physicians are feeling burned out. How does that get...
I was at an awesome conference, and they were talking to this lady who was 80 years old, and she started one of the first community clinics that became a federally qualified health center. What that means doesn't really matter for this conversation, but just know that she was serving a population similar to ours. And she actually, her and her husband in med school bought this, it was an old hotel, and they turned it into a housing facility because there were a bunch of people suffering from homelessness that were living there, and they started doing medical care in it. Right. And it just evolved. And so she knew that she wanted it. I'm getting somewhere, but she knew that she wanted it to be a place that she would want to live. And so when they were building it, they were like, well, the only way to really know that is for us to move into it. So she moved into it. She raised her children in this housing facility. She lived there for a long time until it became a federally qualified health center that she managed until she was 80. And then she quit doing that to just continue to do healthcare in this housing facility. And somebody asked her once, how do you prevent burnout? And she said that she sees Jesus every day in every one of her patients, and that he reveals himself to her through that patient care. And so I think what's unique about what Christ Clinic does is we have the most grateful patients that you will ever meet ever. They're just super grateful people that are used to having not very much at all. They've gone without for most of their lives. So it's just a different kind of interaction. And I think that a lot of people, while don't get me wrong, there are certainly parts of it that can be really mentally and emotionally trying, because you hear some really sad stories for sure. But there's still a piece of it that fills you up, You're getting to help people in a way that they've never really been helped before, and you're able to do something in a situation that it feels like God put you there for that purpose. Like you have all these great gifts, and he put this person right in front of you that needs exactly the gift that you have to offer. And so it's just a different kind of setting.
Okay. That's awesome. That's awesome. What kind of support do you need from the community?
A couple of different things. Donations are always a big one. We are always looking for more funding, and 85% of our donations are coming from individuals for the most part. Some from foundations, but mostly it's either earned income, so from a patient or from a donor. And volunteers, we always rely on volunteers. Even if you're not medical, we take people that aren't medical to volunteer in different capacities.
What do those volunteers do?
A variety of things. So it could be checking patients in at the front desk. It could be it could be data entry. It could be ordering supplies, organizing supplies. If they're open to learning, we're happy to train people how to do basic vital signs and let them do intake for patients. We always need interpreters. You don't have to be a medical interpreter. If you speak English and Spanish, we can make it work. So there's fundraising, help with our fundraising events. If that's your skill set, that's great. And then the other big thing is just awareness, just letting people know that we're there. We can I tell a patient story real quick?
Yes, absolutely.
Okay. So we had a patient referred to us from the hospital with foot drop, and which is like, she just couldn't lift her foot, and she was 34 years old, and they were trying to figure out what was going on with her foot, and then they realized that she had a clot in her leg that was cutting off circulation, so that's why she couldn't lift her foot. So the treatment for that is to do a fasciotomy, which is where they put a cut, they cut you, and it depending on how bad it is will determine how deep they go. But hers were to the bone. So that they could relieve the pressure enough to not have permanent nerve damage. And so she ended up having clots all over her body, and she had to have 2 on each of her lower extremities, and I think 1 on her upper extremities. And it turned out that the reason that she had those clots was from cervical cancer. So they referred this patient to us to do wound care. 34 years old, married, mother of 4. And in the hospital, they were doing her wound care under general anesthesia because it was so painful, but we don't have the capability to do that. So we just had to do, traditional wound care. And she was with us for about 4 weeks before she passed away. And the reason I have lots of success stories I could also tell, but the reason I'm telling this story is because we have the means to do pap smears. We have the means to do endometrial biopsies. We have connections that can help people get leaps. And so she died a completely preventable death because she didn't know that Christ Clinic was there or that there was a way to get a pap smear. She knew that when she had her youngest baby, who was 3, that her last pap smear before she lost Medicaid was abnormal, but she didn't know how to follow up on it.
Gotcha.
So just letting people know that Christ Clinic is there is a huge help, and we can all help prevent a tragedy like that one.
Yeah. Wow. Thank you for sharing that. Yeah. Y'all do great things. Where's Christ Clinic located?
Near Katie Mills Mall, so it's basically Kingsland and Pin Oak. There's an old abandoned hospital there. We're in the black medical office building that services that
How long have y'all
hospital.
been there?
Since 2016.
Okay.
Mm-hmm. Before that, we were in Old Katy.
Yeah. Mm-hmm. Okay. I used to live over in that area, and I would drive by every day.
Okay.
And I didn't know if y'all were still there.
Yeah.
Okay. Mm-hmm. Is that where your office is?
No, we have a separate admin office because we've expanded over the years. We've grown. We needed more exam rooms, so. Our admin office, we pulled all the admin out, and they're actually Kingsland Baptist provides an office space for us to put our administrative team in, so that we could have more exam rooms at the clinic.
That's great to hear. We moved to Cross Creek a couple of years ago, but before we attended Kingsland for 18 years, and we were part of so I know that whole story on we got this little area right here. It'd be great. We can save these charities, these community.
It has been a huge help.
Providers, rent. Take away a big burden, right?
Yeah, it's been huge.
Good.
For sure.
Good. That's awesome. Thank you. We're going to switch gears just a little bit. One last topic. Okay. We want to talk about you.
Okay.
Because you have, there's lots of stress, I can imagine, with your family, not only with your family and the animals, but your job and the impact you're making on the community. And you haven't gone crazy yet. So what are you doing to help stay healthy?
A lot of things, but,
she came with a whole list, and I said, look, we're going to focus on one. And it's great. We need to be doing multiple things. But for the purpose of this conversation, we're going to talk about one.
Yes. So I think one of the big ones is just surrounding myself with people that love people. So it's really cool because I didn't even realize how impactful that was until I started working at Christ Clinic, and I just saw my life drastically change. Not to get too sad or too personal, but I have an intimate knowledge of poverty and an intimate knowledge of mental illness and the effects that it has on people, and how those things are almost contagious. Yeah. Right. And so when I started working at Christ Clinic and started being exposed to people that truly love people, and are accepting of people as they are, and people that are honestly wealthier than I knew existed before I came to Christ Clinic, other than on TV or something, right? But I just didn't know normal people had wealth like that, but they give of it so freely. And you wouldn't know that they have the money they have when you're sitting next to them. They're just normal people, so super humble. And it's just been really life-changing it's easy to take for granted how powerful it is to be surrounded by people like that all the time. And on top of that, they love Jesus, which is a great bonus too.
That's awesome. That's awesome. Okay, as we wrap up, where can people find you? Where can they learn more about Christ Clinic? Where might they even be able to donate?
All on our website, which is Christ Clinic, Katy, like the city, KATY.org.
ChristClinicKaty.org.
Mm-hmm.
Awesome.
Yeah.
Well, thank you very much.
Thank you for having me.
Yeah, I'm glad you could make it, and we will talk to you again next time.
Sounds great. Thank you.
Bye.
Bye.
You can get every episode of Busy People Getting Fit wherever you listen to your podcast or on YouTube. You can also reach us at busypeoplegettingfit.com. Until next time, thank you for listening.